I want to start my contribution by recognising the tireless work of the Limerick-based group Together for Safety, a very visible, open and transparent group of campaigners who have been fighting hard to get this issue back in the political agenda. They are a grassroots organisation of activists who have spent their weekends, evenings and even break times in their workday to promote this issue. They've published a very comprehensive bill. They've lobbied us all in advance of this debate over the past few months, and it is often a lonely station when doing this work, and I think many of us in the room have been those foot soldiers before, but their dedication to this is immense and so impressive. This piece of legislation, as proposed by Senator Paul Gavin and with, as has been mentioned, cross-party support, is clear and straightforward. Legislation to create protest exclusion zones within a defined radius of a facility where terminations of a pregnancy are to take place. Nothing more, nothing particularly less. In 2018, the people of Ireland voted overwhelmingly for a more compassionate country which respected women's and pregnant people's experience and doctors' clinical judgment and enabled abortion care to be provided here at home. 3 years on, I'm still overwhelmed at how strong that yes vote was and by how much the people of Ireland wanted a change to our restrictive, draconian abortion laws. As a country, we had enough of years of secrecy, shame, exile and isolation, and we demanded that people be able to access reproductive health care in this country and not have our shame shipped across the sea any longer. You, Minister, was a part of this campaign, and I don't doubt your personal commitment to this issue, but you have an option today, or an opportunity today, Minister, to put that commitment into action and to follow up on promises that have been made about this legislation. A vital part of that campaign was for people to be able to access healthcare in a safe way, and that safe way means not having to face harassment or intimidation, and we were promised that safe access zones will be legislated for. It is 3 years on and still no dice. Minister, dignity and privacy are two things that every patient attending their GP or hospital has a right to expect. It is the bare minimum and we would not tolerate any less. As it is, abortion is one of the few services that patients must already worry about even being provided by their GP. Only 10% of GPs are providing abortion at the moment. And after people decide to avail of abortion, they should not have to do so in a crowd of people, some of whom they may know from their local area, standing outside their GP offices or hospital, casting judgment on them. This is not okay, this is not fair, and I would go so far as to say that this would not be tolerated if it affected any other group of patients. We have a long and sad history in this country of judging and shaming people for their reproductive choices, and this is simply the newest manifestation of that. These protests are designed to deter people from accessing healthcare and to stop doctors from providing it. Minister, this legislation is necessary and I ask you to put it at the top of your agenda. Safe access zones were promised. We already have let women and pregnant people down for decades in this country. We simply cannot do so anymore. We have more to do in the repeal review, and I'm sure many of us in this House will be engaging with you, Minister, on this. But Minister, your predecessor promised on multiple occasions to legislate for this and he did not. You have committed to this, and yet we are still not there. So, Minister, I ask you to put this at the top of your agenda. This is such a necessary piece of legislation. Please do not yet another year roll by without this being put to bed.